All right, today we're jumping into a really fascinating procedure, one that's kind of at this amazing intersection of medical relief and cosmetic goals. We're talking about Masseter Botox. It's a treatment that can handle anything from nagging, chronic jaw pain all the way up to literally reshaping the contours of your face. So let's just get right to it. What brought you here? Are you someone who's just sick and tired of waking up with a sore jaw? Maybe some tension headaches from grinding your teeth all night? Or are you maybe more curious about the aesthetics, about getting that slimmer, more V-shaped jawline? Well, guess what? Masseter Botox can actually help with both. Okay, so to really get how the treatment works, we've got to get to know the target first. And believe it or not, it all starts with one surprisingly powerful little muscle in your face. So, meet the masseter. This is one of the main muscles you use to chew, and it is incredibly strong. But when it gets overworked, maybe from stress, or clenching your jaw, or even just genetics, it can get bigger. And that's where the trouble can start. And that's where Botox comes into play. Now, I know most of us think of Botox for wrinkles, but the science here is pretty much the same. The injection basically sends a message to the nerves that are telling that masseter muscle to contract and just stops them for a little while. It doesn't get rid of the muscle at all, it just tells it to take a much-needed break and, well, relax. And when that muscle finally gets to relax, two really distinct but equally popular things happen. So let's break down the two main reasons people are so interested in this treatment. On one side, you have the medical benefits. This is for anyone who's dealing with conditions like Bruxism, that's just the technical term for teeth grinding, and TMJ, which is a disorder of the jaw joint. Then, on the other side, you have the purely cosmetic goal, slimming down and reshaping the jawline. For anyone looking for that medical relief, this is huge. By relaxing that overworked muscle, people feel relief from that constant tension and pain. They get fewer headaches, and they stop the grinding that can seriously damage your teeth. For people living with chronic pain, this can be an absolute game changer. Now, on the cosmetic side, it's all about changing the shape. Think about it. When you stop working out a muscle, it gets smaller, right? It's the exact same idea here. When the masseter is relaxed, it starts to lose some of its bulk. This softens a really square jaw and helps create that slimmer, more balanced look in the lower face that some people call jaw reduction. So this all sounds pretty good, but what's it actually like to get it done? Is it a big ordeal? You might actually be surprised by how quick and, honestly, how simple the whole thing is. It really just boils down to three simple parts. First, you have a good chat with a medical pro, the consultation, to make sure this is actually a good fit for you. Second is the injection itself, which happens right there in the office. And finally, they give you a few simple aftercare rules to follow, and then you're on your way. And no, that's not a typo. The actual injection part of the procedure, from cleaning your skin to the last little poke, usually takes about 15 minutes. Seriously, you could do it on your lunch break. Okay, the aftercare, this part is super important. There's basically no downtime, but for that first day, you really need to follow these rules. And here's why. You want that Botox to stay exactly where the doctor put it. You don't want it wandering off to other muscles because that's when you can get some of those unwanted side effects. So what happens next? Well, results aren't instant. You might start to feel the muscle relaxing in a day or two, but the full effect, whether it's the pain relief or the slimming, that usually takes about a week to really show up. And a key thing to remember here, this isn't permanent. You're looking at results that last, on average, about 3 to 4 months. Of course, like any medical procedure, this isn't totally risk-free. Now, it's considered very safe, especially when it's done by a qualified professional, but you absolutely have to know what the possible side effects are. Most of the time, we're talking about temporary stuff right at the injection site. A little bruising, maybe some swelling, but more serious things, while they are rare, can happen, like a crooked smile. And that's usually because the toxin affected a nearby muscle. This is exactly why choosing an injector with a ton of experience is so important. And just as crucial, this treatment isn't for everybody. There are certain medical conditions, like some neuromuscular disorders, and also life stages, like being pregnant or breastfeeding, where Botox is just not recommended. Any good consultation is going to cover all of these bases. So after hearing all of this, we get to the most important question of all. How do you figure out if this is the right choice for you and what you're hoping to achieve? Well, the answer really starts with a conversation. And that consultation, it's a two-way street. You need to come prepared with your own questions so you can feel completely confident and informed about your decision. Here are the absolute must-asks. You need to know, am I a good candidate? What kind of results can I realistically expect? And what are the risks for my specific case? And maybe most importantly, you have to vet their experience. Don't be shy. Ask them if they're trained in this specific procedure and ask to see before and after photos of their own patients. So we'll leave you with this final thought. Masseter Botox offers a really powerful but temporary solution. The decision really comes down to a personal calculation, weighing those amazing benefits against the cost, the potential risks, and the fact that it isn't permanent. That's a call only you can make.